We've just had accepted the third in a series of publications using the Rochester Epidemiology Project and a traumatic brain injury cohort, a population-based cohort of individuals in Olmsted County that have had traumatic brain injury. It's the third in a series of publications, the first looking at the incidence of traumatic brain injury, which showed that using a population base to identify cases, if you will, individuals that have had traumatic brain injury, really is the most accurate way to count them, rather than only counting individuals that have received medical attention in the emergency department or a hospital. The second in the series looked at cost, population-based cost, and the advantage of having a population base is that you can identify controls, individuals that have, for example, that have an injury of the same severity as a traumatic brain injury individual, but without a brain injury. So two people that have had injuries of the same severity, one of which had a traumatic brain injury, one that didn't. Then you can measure cost over time. And then the third is controlled survival using the similar kind of controls. What we wanted to find out is whether or not individuals, if they survived greater than 6 months, if they died more earlier, or at risk for death more so than individuals that had an injury, just not a traumatic brain injury. And we found that they didn't. From a rehabilitation standpoint, that is relevant to us because if you survive a traumatic brain injury at 6 months, it's possible, if not likely, that you will have acquired some alteration of brain function, but you won't die any sooner than you otherwise would have. So it's important that you have adequate services in the community from a medical standpoint, rehabilitation standpoint, to maximize your participation in life.